Welcome to the Essential Substance Abuse Skills webinar series. I am Kate Trams, and I will be administering today's webinar. Today, Dee LeBeau-Hein will be speaking on referral, service coordination, and documentation. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. The National American Indian and Alaska Native ATTC is one of 4 national focus centers which serves the ATTC network. The ATTC network is a nationwide network made up of 10 regional centers, 4 national focus centers, and a network coordinating office. The map on this slide shows the locations of the 4 national focus center ATTCs. To learn more about our center, the network, or your regional center, please visit our website. This series is designed to be a broad overview to assist in preparing for written alcohol and drug certification examinations, to enhance existing knowledge, and to improve overall competence and treatment outcomes. Please be aware that this series is not meant to stand alone, and previous education and training is necessary in order to pass alcohol and drug certification exams. We recommend that if you are preparing for an exam, that you seek additional preparatory help and let this course be one of the many tools you use to prepare. Our next webinar in this series is scheduled for Wednesday, March 19, when Bob Rarrett will present treatment knowledge. In addition to this webinar series, we offer another series titled the American Indian and Alaska Native Behavioral Health Webinar Series, which presents on current topics of interest in the behavioral health field. Excuse me.
Hello?
The next session in this series will be held on March 5th from 1 to 2 p.m. Eastern Time, where Jackie Gray will present on Disrespecting Our Elders, Elder Abuse Indicators and Screening in Indian Country. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs. The cost is $10 to do so. The CEH request form is available for download in the Files pod in the webinar screen. If you choose to download a file, a new tab will be opened in your browser and you will have to click on the webinar window to return to view the webinar. If you are unable to download the documents from the webinar, please contact me using the information on the slide. Immediately following today's webinar, you will be redirected to our GIPRA evaluation. We invite you to participate in this brief online customer survey. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. GIPRA stands for the Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. SAMHSA uses the information collected by these surveys to determine how many people have attended our events, your satisfaction with our events, and how useful our events are to you. We hope you will assist us in gathering information about our services by participating in our survey. Before we start today's session, I'd like to go over a few instructions for the Adobe Connect system. To view the presentation in full screen mode, click on the full screen button at the top right corner of the presentation pod. To return to the regular view, click the button again. You will be muted for the duration of this webinar. Please use the Q&A pod to share your questions and comments. Your questions will only be visible to me, the webinar moderator. I will pass your questions along to the presenter at appropriate points in the presentation. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in another window, the system will record your participation as inactive, which may be reflected in the number of CEHs received. Today's speaker is Dee LeBeau-Hein. Dee is a member of the Minikuju Band of the Cheyenne River Sioux Tribe in Eagle Butte, South Dakota. She currently works as a mentor for the Tioshbaye in Engineering program at the South Dakota School of Mines and Technology and serves as the president of the board of directors for the Sacred Heart Center, where she oversees a women's shelter and adolescent program. Dee, thank you so much for joining us, and I will pass things over to you at this time.
Thank you, Kate. Okay, can you hear me?
I can hear you.
Okay, very good. Thank you, Kate. I want to welcome everybody online. My screen isn't forwarding. There we go. Okay. Today's session, we're going to look at the referral, service coordination, and documentation process that's needed in the recovery process. Our goals today and our objectives, we'll be looking at 5 areas in the referral process: service coordination, documentation, case management, utilizing the strengths perspective, and some research. We're using a recovery-oriented response, promoting self-care and rehabilitation. The recovery-oriented systems of care is a person-centered, self-directed design for ongoing support for the individual, family, and those in the community. This approach pulls away a little from the acute care module that most treatment have utilized in the past. Today we're using more of a chronic care approach. The system builds on the strengths and the resilience of individuals, families, and communities. It utilizes a continuum of care rather than a crisis-oriented care. The key, again, is person-centered, self-directed, and it's designed to readily adjust to meet the individual's needs and chosen pathways to recovery. And in this illustration, you see the recovery and the arrows going down to wellness and health, and the individual, family, and community are in the center. So, recovery-oriented systems of care offer a comprehensive menu of services and supports, which you're going to be introduced to here in the following slides. And the important thing here to remember is it's going to meet the individual needs of the client you're working with and their family and their support structure. Typically, when you're designing a treatment plan, you're not utilizing a one-size-fits-all treatment plan. You're going to want to utilize a treatment plan that's going to specifically relate to that personal individual's needs. Here are a few services and supports systems that are typically out there around the individual. You have the housing, transportation, spiritual, financial, case management, problem gambling, vocational. All these work together in your community and will work to help the individual. And then on the outside, you have mental health systems, primary care systems, vocational services, housing authority, social services. Again, those are all going to be support systems that are going to enhance the recovery process for your client. And the idea, we want to hope to get the client into employment, reduce crime, get them into a safe and drug-free housing. These are some of the benefits for the client, for the community, for the family. So what is referral? The process of facilitating the patient's utilization of available support systems and community resources, again, to meet needs identified in clinical evaluation or treatment planning. As a substance abuse agency, treatment facility, your community and your relationships within your community are going to be vital to supporting the recovery process for your client. If you're new in the area, I would strongly encourage you to open up a phone book, sit down and talk to a few folks and ask what is available in the community. Here are some examples of sub areas that you might want to look into. Governmental entities, other professionals, spiritual community, things that are going to support, again, your client. In the referral process, continuously you're going to be assessing and evaluating the referral resources to determine their appropriateness, because not, again, one client may work well with being referred to health and wellness screening, while another one is fairly healthy in the respect of their physical well-being, but emotionally they may need help in another area. So it's really important to be ongoing working with your client throughout the treatment process, during the aftercare process, during the follow-up process. Maybe there's relapse prevention. All those are going to be ongoing in the referral process. You're going to be mindful of all your service providers and be aware of all your available resources in your community and within maybe the immediate family or the extended family, which in Lakota we would say Tioshbae. Establishing and nurturing collaborative relationships with key contacts in community service organizations, interpreting and using evaluation and patient feedback data. When you're sitting down to do your treatment plan with your client, this is really important to pay attention, to make personal notes if you need to. What is it that's going to enhance or encourage and support the client's recovery? Giving feedback to community resources regarding their service delivery is crucial. Being able to follow up and see how things are working for them, so you're providing adequate referral services within your community or whomever you're working with. Being able to differentiate between situations in which it is more appropriate for the patient to self-refer as opposed to requiring a counselor to refer. Again, this should all be identified within your treatment planning. As you're sitting down doing your assessment, having a conversation with your client and being familiar with if they've had various treatment experiences, what's worked for them, what hasn't, where did they find the most support in their community when they were actively in recovery, if they're back in treatment. These are areas that you're going to really want to explore with them. Interpreting assessment and treatment planning materials. It's important that you're able to assess the patient's readiness during this time. You can use you may be able to use the motivational processes, stages of changes, Prochaska, or the pre-contemplation, contemplation, preparation, action, being able to assess where the client's at in their readiness for change, and educating the client regarding appropriate referral processes. In one of the agencies that I worked with, we would tell the clients when they came in that we were referring them over for a mental health screening. And their first reaction was, "Are you telling me I'm crazy?" No, but we want to make sure that we address every area involved in your recovery, which is also your mental health, in addition to your emotional well-being, in addition to your physical well-being. So they understood that we wanted to address holistically their healing process. So they understood that, and once it was explained to them in that fashion, they were more willing to participate in a mental health screening. Arrange referrals to other professionals, agencies, community programs, or other appropriate resources. Again, it's important that you develop a rapport with these professionals and agencies. Calling from time to time, maybe stopping in to see what new resources may be available in their programs, in the agencies or with the professionals. Sometimes there's a turnover in the person that you're working with. If you have a rapport with them, you'll know when they're going to be leaving and who's going to be taking over. So if you refer your client over there, they won't be left hanging. They'll understand that there might be a change in the works or those kinds of things. So this is some of the important reasons why you would want to develop a rapport with your support services. Explain in clear and specific language the necessity for and process of referral. Again, if a client is feeling uncomfortable, is hesitant, is you really need to take a look at that and address that and find out what's behind that. So when that referral is made, they're going with an open mind, a willing heart, and and wanting to engage in that referral process. Exchanging relevant information with the agency or professional. Again, this helps with the services you're going to be providing. In addition, we would often, for those of you in the field, you know that co-occurring disorders now, we're working together closely with the mental health professionals. And so if, say, for example, you referred them for a mental health evaluation and they came back diagnosed with depression and they've been put on medication, you understand that counseling also helps with medical management, med management, and so you work together collectively to achieve the goals that you set in the treatment plan with the client and with the mental health care professional provider. So keeping on task or keeping yourselves in the same mindset of what the goal is for your client and the outcome. So when you're developing and providing coordinating services, the administrative, clinical, and evaluative activities that bring the client treatment services and community and resources together, you really need to focus on the issues and needs identified in the treatment plan. And again, while you're sitting there doing the assessment, you're going to identify real specific needs. A client may have a lot of anger issues that cause some of the legal problems that they're addressing right now, in addition to the alcohol and drug use. So knowing that, you're going to want to look for maybe anger management classes out there, or those kinds of things. So developing that with your client and with and knowing what services or what are available out there, you can work together in getting those services set up for the client. Service coordination really also includes case management and patient advocacy. Sometimes as counselors, we don't think about doing case management, or you may actually have a case manager on staff. A lot of agencies, the ones that I've been exposed to, one didn't have the funds to support that position, so we would often take on that role as a case manager in addition to being their immediate counselor. Where another agency did have a case manager on staff, so we worked closely with them and what we were doing with the client. So we coordinated times when before they would leave treatment. We'd make sure the case manager, she would make sure that they were set up for follow-up in their community where they were returning to. She would make sure she would give them a list of where the AA meetings were at. She would make sure that if they were women and needed prenatal care, she would make sure she had those resources available for them prior to leaving treatment into their community. So some of those services need to be coordinated prior to releasing the client into their community. And as a patient advocate, you might need to go and assist the client in an area that they may need help in with their health, their recovery. And this establishes a framework of action for the client to achieve specific goals, and they see that you're doing what you can to support them, and it's really up to them to take the necessary steps to follow through. Just to be mindful, you don't want to do more work than the client, but you want to surely support them in their recovery process and provide all the adequate resources that you can for them. Service coordination also involves collaborating with the patient and their significant others. And again, like in Lakota, in our area, the Tioshpai is considered the extended family. I had a group of clients that I worked with that it was very important for them to have their family involved in their treatment program, whereas I had other clients that their family were still actively using and they were very uncomfortable about sharing or having them involved. So it's really important that you discuss with your client who is supportive in their immediate family or their Teoshpe that's going to support their recovery process, because not always will a family be in that situation where they're all healthy and they're all wanting them to come into recovery. For many of our tribal communities, we have a large concern with alcoholism and drug addiction and family violence and things like that. So we try to protect the client from within their own immediate family and their Tioshpai. So just be important, be mindful that you're collaborating with your client and their significant others in that process. Service coordination also involves coordination of treatment and referral services, liaison activities within community resources, liaison activities with managed care systems, and again, it's ongoing evaluation of treatment progress. And that's key to be mindful of is the progress. Oftentimes, maybe a treatment program might say that everybody has to go to AA 3 times a week. Well, you've got clients that are coming back saying, I'm not really getting anything out of it. It's not really working for me. I'm more frustrated than I was before going to the meeting. So you're going to want to look at alternatives. In this example, there's really not any progress helping the client in their recovery process. So you've got to have other alternatives for the client so that they are growing, that they are getting the necessary care to help them in their recovery process. So they are able to achieve those treatment goals that you've set. And ongoing evaluation of patient needs. There's different levels of care, as you all well know. Certain clients may proceed well in that process, and some may not. Some might have a little need more time in certain areas of level of care. So it's important to do ongoing evaluations for their meeting their needs. Service coordination includes implementing the treatment plan. Of course, you're going to have that in front of you and in front of the client as you're talking about different referral processes, what's going to help them in their recovery. You're going to want to obtain, review, and interpret at all relevant screening, assessment, and initial treatment planning information. Some of your screening tools are utilized at the very beginning of treatment when they come in, and it helps you develop their treatment plan and assess the level of care that they're needing. And some screening tools are used during the treatment process to see how their maybe behavioral changes or mental health changes or maybe physical health changes. Some screening tools are used in the end to determine whether there was a significant change or shift in their treatment or their personal well-being. So being mindful of that and being able to utilize what screening tools are going to help you and understanding how to interpret those and utilize those in the treatment process. Confirm the patient's eligibility for admission and continued readiness for treatment and change. Again, if you have something that you're using to identify their readiness for change, That's something that you're going to want to ongoing keep track of uh, to see what, when, and where they'd be more apt to make those positive changes. Um, and working again closely with the client to make sure that they're aware of what you're using. They understand why you're using certain tools in the process to determine that. Complete necessary administrative procedures for admission to treatment. You all have your own criteria that you use, making sure that the client's able to come in to treatment without jeopardizing losing their home or losing their jobs or even losing their children. I mean, that's something that you're going to want to work closely with them to make sure that the timing is going to work for them. They have adequate time to prepare or get things in order for them to come into treatment. So just some things to be mindful of as you're preparing to get them ready to come in. Establish accurate treatment and recovery expectations with the client and their significant others. Again, this is huge because you want to make it attainable, and it needs to be something that's measurable for the client to be able to see that they're able to achieve what they're setting out to do. So this is something that you're looking at in your treatment planning. You want to make sure you do establish accurate treatment and recovery expectations. And they'll tell you, I don't think I can do that, or I don't think my significant other is going to support that, or whatever it may be. That's something to discuss and determine whether that's achievable or not. Coordinating all treatment activities with services provided to the patient by other resources. You want to develop and maintain a community referral list. We, at one of the agencies I worked at, we often had, we'd ask clients to get a sponsor. And that sponsored list would often change. People leaving the community, people coming to the community. So we had one person on staff that would keep that list fairly accurate and contact numbers up to date. Just something like that you would have available. Develop multidisciplinary collaborations within the community, accessible as needed, depending on what you're looking at with your client. If you have a number of areas that you're working with, you want to keep it simple. You don't want to overwhelm your client, but you want to let them know that there are other resources available that can help when they're ready to get into other areas of their recovery. Deliver case presentations, use appropriate technology to collect and interpret client treatment information for diverse sources. Again, appropriate technology, it's within your agency, what you have available, what resources you have available within your program. Understanding how to collect that and interpret that to provide adequate client treatment. Demonstrate accurate, clear, and concise verbal and written communication. I've had clients come in that have told me they went to a different treatment program and they didn't understand what they were supposed to be doing. They didn't understand when the counselor would come in and talk to them. They said they used all this jargon or words that they didn't understand. So they were confused, and they lost the attention of the client. So it's really important that as a program, as a provider, that you do use clear and concise verbal and written communication, that the client does understand what you're doing, as well as your coworkers. Because as you're going to see in later slides, documentation is going to be very important in communicating to your service providers and within your agency and within your community, what it is you're expecting or what it is that you're hoping for the client and their achieving their goals and objectives. So you're really going to need to be able to verbally communicate that, and articulate that in your writing as well. Participate in interdisciplinary team building. Um, we're seeing a lot more group activities in play now in the treatment uh, programs, where it's important that it's important that clients are able to work within a team, that you as a provider are able to work within a team, within your agency, within your program, within the community, being able to interact with others without dominating or taking over, but keeping in mind that the client's well-being and their care. Participate in negotiating, advocacy, conflict resolution, problem solving, and mediation. Um, I don't know if some of you may have somebody on staff that does this. If they do, it wouldn't hurt to have an idea of some of the things that they're doing. So if for whatever reason they're not available, you're able to step in and help support that process, and be able to participate in that with them. Assist patients in developing and maintaining contact. It's huge to keep contact with your clients. Some, if you allow them to not come into the office, they won't. You almost have to, even if you have to go out and meet them in their area, or you have them come in once a week or wherever they're at their level of care. If they're out, if they're in aftercare, it's important to have that interaction with them face to face, because you get a feel for a person's body language. You get a feel for where they're at, if how they look, if they're comfortable, those kinds of things. I would encourage face to face contact, more so than telephone and electronic. In this day and age, we're doing a lot of email contacts, which is fine, but you don't always get the human connection, which I think is important in anytime you're working with a client. And then document, and we'll get into a little more specifics in that. So service coordination also includes consulting, summarize patient's personal and cultural background, treatment plan, recovery progress, and problems inhibiting progress. It's really important to understand a client's cultural background. If they are they come from a traditional background, then it's important that you utilize their network behind them for support, added support. It's important to understand if they have no cultural understanding of their history or their family, and you wouldn't want to send them to a traditional ceremony or ask them to participate if they have no understanding of that. That could cause them to feel very uncomfortable, and pull away and pull back. So it's important that you do understand your client's personal and cultural background, so you're putting them in situations that they're willing to be in and they're comfortable. And unless it's, like my earlier illustration of somebody with maybe anger management issues, they may have a difficult time going into a group setting and talking about that. In that situation, it may not be uncomfortable, but it's necessary to address their anger issues, something like that. So you're aware of, they might need to be in an environment that may be a little uncomfortable, but it's going to be overall beneficial to the client and their immediate family. So being able to summarize those things, understand terminology, procedures and roles of other disciplines related to the treatment of substance use disorders. This is huge. I've worked with counselors. I've worked with some healthcare providers that didn't understand certain terminology, didn't understand certain procedures, and roles that were required. As a clinical supervisor, it's very important that you train your staff, and even your secretaries, your clerks, that they're even understanding, your residential aides, that they understand some of the terminology that may be utilized in the facility. So if a client is being assessed, and like if it's an inpatient treatment facility, you would want to make sure that they're documenting maybe in the evening how the client's doing, and you might give them an assignment, give the client an assignment, and they come up to the residential aide and said, my counselor asked me to do this, and this, and I don't understand what they meant. As a residential aide, you're familiar with the terminology. You're able to communicate that with your client, with the client, and that'll support that process. So I think the more synergy you have within a group of providers, healthcare providers or treatment providers, it does support the overall outcome for the client. So understanding terminology, procedures, and roles within the treatment. Consulting, contribute as part of a multidisciplinary treatment team. If you're doing clinical screenings, or clinical staffing, you may be a part of a disciplinary treatment team. You might be asked to participate in maybe a mental health program that wants you to come and be involved and share your input from the substance abuse field. So being able to contribute as a part of that, what is it that you're going to bring, and what is it that you want to help for the overall well-being of the client, the agency, the treatment program, the community, that particular program, is important as well. And of course, applying confidentiality regulations appropriately. We are all bound by federal law, state law, maybe agency policies, and of protecting the client's confidentiality, being aware of what your parameters are in that is very important as well, if you are going to be a part of a multidisciplinary treatment team. Speaking on behalf of your client or agency, what are you able to share, and what isn't appropriate to share. So service coordination includes continuing assessment and treatment planning, as I mentioned before, maintaining ongoing contact with the client and involved significant others, family, friends, spouses. Understand and recognize stages of change and other signs of treatment progress. This is really important, not only for the client, but for the treatment program as a whole, and as the healthcare provider, the counselors, you want to be able to identify that there are measurable changes happening. You're seeing the changes within the client's behavior, their thinking, their attitudes, their approach to things. It's important to be able to recognize those stages of change. And again, those are things that you're going to be documenting. Make appropriate changes to the treatment plan to ensure progress towards treatment goals. I had a client come in that she was diagnosed with depression. As we were going through the treatment process, it turned out that her depression was a result of unresolved grief. As we began to work on her grief issues, it became obvious and apparent that she didn't need the medication that she came in presenting with, her depression and such. She was using alcohol to medicate. And once again, we start working on her grief issues, she started coming through that. She found some healing in that. She progressed. She was a lot happier. She identified areas in her life that were holding her back because of her depression, but she felt confident to move forward now that she began to address her unresolved grief. And those instances, being able to identify those changes and um, realigning her treatment plan, um, making the appropriate changes to the treatment plan. Um, so when she left, when she left our treatment program, we put her into a support group for grief that helped her continue working with that. Those kinds of things that we added to. So being mindful of knowing when and where and how to change the treatment goals as the client's progressing through their recovery. Describe and document treatment process, progress, and outcome. Um, if you're like most agencies, you got a ton of paperwork and you're always documenting something. They want to know everything, and it's important that you document everything. If for whatever reason there's an emergency, the immediate counselor, assigned counselor isn't available, any counselor should be able to open up that file and be able to pick up where you left off, or at least have some understanding of what you were working on, and what needs to continue to be worked on, and those kinds of things. So documentation is very, very important in the treatment planning and service coordination. Using accepted treatment outcome measures. I don't know if any of you are using ASI, the Addiction Severity Index. Sometimes you can utilize that in looking at there's 7 domains that ASI uses. There's medical, employment, legal, family, psychiatric. So whatever areas that you might be using in the ASI, you can utilize that to see where they're at in each of those areas. So you're able to measure, if you've had an impact, or if the client's working well with certain areas, and you may be able to move on to the next important area that you've assessed and identified. Continuing care, relapse prevention, and discharge planning with the patient and involved significant other. Continuing care, again, treatment doesn't end when the client finishes the program. As you all well know, there's another level of care that the client goes into, and there you would continue to participate in the client's recovery, or refer them to somebody in their community that would take them maybe to outpatient once a week counseling, or whatever it may be. So documenting service coordination activities throughout the continuum of care. So you're consulting with maybe the outpatient counselor at the end of the week to see how the client's participation is going. Things like that. That you're putting that in their file. Apply placement, continued stay, and discharge criteria for each modality of the continuum of care. And again, understanding that there are different stages of recovery, understanding that you have different levels of care provided, understanding how to document in those areas, and what it takes to move them to a different level of care, being able to write that in a manner that's clear. So if and when that you do a review for the client, everything's there and it's easily understood, and doesn't leave a lot of open-ended questions. Okay, so looking at documentation, then you're going to be recording screening and intake process, of course. Most of you have that, I believe, on on a automated or on a system now. It's not all hand done anymore. um, Utilizing or recording the assessment, your treatment plan. You have your clinical reports, your progress notes, discharge summaries, and any other patient-related data. And mostly any other patient-related data may be some of your resources you're utilizing within the community um, referral in your referral process. Um, Documentation, demonstrate knowledge of accepted principles of patient record management. It needs to be done timely, clear, and concise records that comply with regulations. Again, you might have agency, federal, state laws, policies, procedures, regulations that you would need to adhere to. Understanding those and being able to um, document that information accordingly. Um, and you want to document that information in an objective manner. That's important to take note of. You want to protect the patient's right to privacy and confidentiality in the preparation and handling of records, especially in relation to the communication of patient information with third parties. Okay, and this is important because you might have an incident where when you're doing the assessment and you're doing the clients coming in and signing their paperwork and those kinds of things, most of you, if not all of you, talk about their right as a client in your agency and what your responsibility is in protecting their right to privacy and confidentiality. Sometimes this gets a little tricky if you're in a small community. I've worked at an agency that a lot of family members were coming through the treatment program. A lot of family members were coming into a group saying, "Oh, that's my cousin," or "Oh, that's my brother's wife," or whatever. It's important for you to understand how to protect your clients' rights to privacy and confidentiality. If it means pulling them out of group and doing individual counseling, if it means reassigning them to a different counselor because they're related to a counselor there, or things like that, you got to be able to protect their privacy in the best way you can. Sometimes it can be a little challenging, like I said, when you have a small community that you're working with. The other important issue is if you have a client that maybe reports sexual abuse or incident, or if they know of somebody being sexually abused in the family, you have an obligation to report that, and it's important that your clients understand that. The times that you are obligated by law to perhaps I don't want to say break confidentiality, but tell them that there are certain things that you are obligated by law to report, which is if they are suicidal, or they know of somebody that is suicidal, or somebody's being sexually assaulted or abused, and that you're aware of that, or a child is being abused. You by law have to report that. And most clients, when I've done this, understand that. So if they do self report that, then they understand that you, as a healthcare provider, are obligated to report it as well. So understanding how to document this information. Request, prepare, and complete release of information when appropriate. Here, if you're working with youth group, you got to have all your release of information signed and ready for the parents, if the parents want to get involved, or a family member. Again, It's at your agency policy and procedures and how that work, but you know when it's appropriate to do so. Prepare accurate and concise screening, intake, and assessment reports. Again, as a counselor trainee, this is something that you're going to you learn. The more you do, the better you get at understanding how to report and document this information. Whenever, if you're in doubt, please seek out a certified counselor, seek out your clinical supervisor, but never make assumptions of not reporting something if you're not sure. It's important to ask, because again, when you're staffing a client or you're moving a client to a different level of care, you're going to have this history there available for other providers, and you want to have as concise and as accurate documentation as you can in each of these areas. Psychoactive substance use and abuse history, you're going to want to understand where the history behind a person's use. How many times have they went to treatment? What worked for them? What didn't? What's their physical health? They're diabetic. They never addressed it, and now you're working on addressing their diabetes now, or just those kinds of things. A history of criminality. Is there a pattern there that you can link and you can help provide the client with adequate services to address those issues. Cultural orientation. Again, you don't want to assume that the client understands their cultural background. Many of our own, we're a small agency that I worked at, many of our own clients that came in on the reservation didn't know a lot of the culture that they were surrounded by, or why things were the way they were and why we did what we did. Never make that assumption. You always want to discuss that with your client and see where they're comfortable at. Some programs may have a cultural assessment tool to use to talk to the client and see where they're at culturally. And that way you have an idea of if there's something there that you can put in their treatment plan to help them in their recovery. Record treatment and continuing care plans that are consistent with agency standards and comply with applicable administrative rules. You have your informed consent. You document in a timely, clear, and concise manner. Again, most of you are required to document most of your information fairly soon, right? You have to submit a report to your clinical supervisor, so a lot of this needs to be done in a timely manner. Recognize the importance of recording treatment and continuing care plans. Again, it's ongoing. You want to if you need to make any adjustments to the treatment plan, it's important that you document that information, and so the adjustments are being made accordingly for the client and for the other staff or the team that you're working with the client. Record progress of patient in relation to treatment goals and objectives. Use appropriate clinical terminology. If you're not sure how to write progress notes, sit down. I'm sure you're going to get training in that, but it's always helpful to when you're being shadowed by your clinical supervisor to be able to ask questions appropriately, comfortably, and so you're writing correctly. Review and update records. There were times when we would pull files, just to make sure we had everything we needed to, and sometimes we had outdated informed consents, or sometimes we had outdated documentation in there. So it's really good to be able to go through your files and make sure you do have updated records and review them from time to time. Prepare clear and legible documents. Your treatment plan is considered a legal document. If there was ever a question of you were called or to court or to discuss a client's um, treatment progress or whatnot, there's certain things you can share and certain things that you wouldn't share. An example would be if you're working with a client on maybe some sexual abuse issues, and you write a progress note, and you're not going to put in-depth information about what you discussed with the client in your session. You're going to want to document, client and I had a discussion about a previous sexual assault sexual assault experience or incident, something like that where you're not getting into detail. So being able to write it in a manner that's not giving out too much information, but being specific and giving the information for others to read if they need it to. Document changes in the treatment plan. The example I gave with my client that came in depressed, which in essence it was unresolved grief. I documented that shift in her treatment plan. We began working on more extensive grief issues, and we looked at closely working with her mental health provider to assess whether she needed to continue on her medication for depression. And it turned out at the end of her treatment, she didn't need to be on her medication, based on the tools and the additional skills we gave her to identify when she was triggered to go into her depression was because of her grief. We were able to work on identifying those areas of where she needed to reach out, or whatever assignments we had working for her. But just so you're documenting those changes as needed. Prepare accurate and concise discharge summaries. Here, it's important to follow your program or your agency's policies in this. Patient profile and demographics. A client might come in living in one place, but they're going to move to another place for support reasons. So you want to make sure you accurately document that living change. Presenting symptoms, diagnosis, selected interventions. Most of you should be aware with these progress toward treatment goals and how to write this and document all these different areas. Document treatment outcome using accepted methods and instruments. Again, what your program is using. If you're not familiar with what methods and instruments are available, it's important to get that information so you understand what they are, how they're used, when they're used, and who they're used with. Gather and record outcome data, incorporate outcome measures during the treatment process. Again, most, if not all, clients like to see measurable outcomes, so you can put them on a continuum and show them that you started off here when you came in, but this is where we see you at now, and at the rate you're going, we see that you could be moving in this area. They see that they're moving and they're progressing. They like to visually see that, and that they'll work harder at achieving their goals and objective. Recognize that treatment and evaluation should occur simultaneously, so that it's ongoing. You're always going to be doing evaluations while you're working with the treatment to see what's working and what's not. So that should be working together. Appreciate the importance of using data to improve clinical practice. So you're collecting that data and you're working and using it to help improve what's working for the clients in your agency. So here we have the community case management. In the strengths perspective, again, if you're doing this yourself or you have somebody on staff that's doing this, or you would want to do this, seeks to encourage patients to become more deeply involved in their own treatment. So it's really self-empowering, getting them more involved, finding ways to do that. Again, if when they're coming in, they're actively involved in the treatment planning, they're actively involved in the different changes and the progresses that that are being made, why certain modalities might change to the treatment process, why you're bringing in certain service providers, why you're referring them to different areas, and the client is involved, actively involved, you're going to find that they will be more involved in their the outcome of their treatment. Simultaneously assist patients in learning how to require and retain resources that will support their recovery. I would, when I would do the aftercare planning and the client and I would sit down and go through that, I wouldn't say, well, you're required to do 3 AA meetings a week and attend church once a week, when I knew, in fact, the client didn't like to go to AA meetings and they weren't spiritually active at that moment. I would ask them, what is reasonable? You tell me what is reasonable for a support system for you. And I remember a client saying, well, rather than going to AA meetings, I would rather go to Bible studies if I could do that instead. If you're going to do that, and if that's going to help you in your recovery process, it's better. I would rather you do that than me to assign you to something that you're not going to do. So it's important for the client to understand what resources are available for them, and most of them know what they enjoy doing, when they're not using. So it's important that they understand those resources that are available in their community as well. 5 principles whereby the case manager facilitates the patient's identification of his or her strengths, abilities, and assets. And again, if you're on a team, an interdisciplinary team, this might be an area where you work together and you all have interaction with this client, and you're all able to identify some of their strengths that maybe you didn't see but another person sees, or what their abilities are that you see and the other person doesn't see. So you're able to identify what those strengths, abilities, and assets are for the client. Assist the patient in focusing goals, identifying alternatives, and locating resources by encouraging the client to identify his or her own needs. When a client came into our treatment program, I would have them give me a list of support people in their life. And they would say, well, Aunt Judy, but I haven't talked to her in a couple of years because I've been using. And I'd say, well, would you be willing to reach out to Aunt Judy and see if, they would be willing to be a part of your support system? And 9 times out of 10, they are. Whether it be writing them a letter or giving them a phone call or me calling them or whatever, they would identify who their support people would be, and we would work on that. So those are just some ideas that you can do to encourage your client. Like I said, most of them, they know who in their family will support them. They know where to go in the community that will offer support in their recovery. And if they don't, you have a list available for them. A case management serves as a primary advocate for the patient and coordinates all relevant services. I said we had a case manager. She would go out into the community and she would find out the times and places for prenatal health care. She would find out if there were any meetings for anger management. She would go out and find out if there were any parenting classes available for the clients. and she would have those times and places available for them. So as a case manager, that's something that you may need to do, is go out there and find out and coordinate that information or those services for the client. Encourage positive and proactive identification of resources, social supports, friends, families, and neighbors. Work with patient in the community to maximize the fidelity of the provider's perceptions and the patient's experiences. You're gonna want to keep in mind that the client, depending on their level of care and depending on where they're at in that continuum of care, being able to stay connected with the client, even if they leave your immediate treatment program and they return home into their community, you're going to want to keep that contact with them. Some of you have follow-up questionnaires that you have to have filed at a certain period after they're discharged from your program. Hopefully you're not doing that and had no contact with them for several weeks, and then all of a sudden you're calling them out of the blue and they're surprised. Hopefully they're expecting your call and they're ready for the follow-up, and there's no breakdown in that process. So it's as a case manager, if you're fulfilling that role, you're utilizing a lot of these strength perspectives and helping your client. Or if you have a case manager on staff, these are some of the areas that would enhance their management of the client's recovery. And then we have the research, case management research. Comparing research results across case management oriented programs is difficult because of the way the case management concept is defined. There are more studies needed regarding the degree to which the type of program influences retention. So this is an ongoing research, not to say that yours isn't working or theirs isn't working. It's just a collaborative and documenting and keeping track and measuring all these things in the case management process. So if it ever comes to you're asked to support your data or how is this working, you have that available to you. And here's a research site, just some information, that some areas that you might want to go to that have a lot of good information. In the beginning, I introduced the recovery-oriented systems of care. There is a site out there, it's Faces and Voices of Recovery.org. Faces and Voices of Recovery.org. They have a lot of good information that regarding the recovery-oriented systems of care. On page 18, they give some good information with the recovery ROSC, I'm going to say ROSC, R-O-S-C approach. So there's good resources out there to help you as a trainee, help you as a clinical supervisor, help you as an active counselor to address your client and be able to develop or design or what services are provided for the referral process, and being able to document your information and those kinds of things. I think that's our summary, and that's the end of our, pretty much the end of our presentation here. So we've talked about the referral process. We've talked about the service coordinating, documentation, the importance of that, the importance of documentation, the case management model, strengths perspective, and research. So we'll come to the end, and I'm willing to answer any questions that you may have. We'll turn it over to Kate.
Thanks so much, Dee. Yeah, thanks for sharing that with us and just giving us a great presentation. So you can see on the screen there what the chat or what the question and answer pod looks like. So please submit any questions that you have for Dee and for her presentation at this time, and we will work our way through those. And then immediately following this, there's just a few items that I'll go through with instructions for follow-up um, as soon as we address any questions. So um, please take a moment and submit some questions at this time. Why don't I, while we're waiting, just if anyone has questions, please submit them. But I will just go through my follow up at the end here, and then we'll come back in case there are questions that come in the meantime. But please stay online as we close out the webinar so you can be redirected to our survey. If the survey doesn't automatically pop up, you may copy and paste the URL on the closing webinar screen to access the survey. Also, please watch your email inbox for our follow-up, which will include a link to the recording of this webinar. We hope you'll be able to join us for the next webinar in this series, Treatment Knowledge, with presenter Bob Rarrett on Wednesday, March 19th. We hope you'll also be able to join us for our next webinar in our American Indian and Alaska Native Behavioral Health webinar series on March 5th, when Dr. Jackie Gray will be presenting on disrespecting our elders, elder abuse indicators, and screening in Indian country. Thank you again for participating in the session today. And it doesn't look like we have any questions at this time. So Dee, did you have anything else you wanted to add?
No, I just want to thank everybody for being online, and I just want to say thank you for the work that you're doing in the communities to help our Native people in their healing process. I really admire all the work that goes into that, and I just want to thank everybody for doing that and participating today.
Wonderful. Well, thanks again. And yeah, we will go ahead and close out this webinar. And again, please stay on the line as you'll be redirected to our survey.